So welcome everyone to I think this is our fourth Doc Rob Live Q&A, an opportunity for you to ask me questions and to learn more about supplements and holistic approaches as well as conventional approaches um, to things that your pet may be involved with, problems that your pet has. And I'm joined tonight as my co-host, Haley Schultz, who's my right-hand person. Without her, I could not do this because I'm an old fart and she's a young fart. Um, and so I thought I would have Haley get started um, and um, and do some housekeeping information and do the disclaimer. Um, before we get and then talk and then the next slide as well, talking about just the general overview of these Q&As, and I may pipe in on that second part about what we're thinking about doing. As these seem to be fairly successful, fairly well attended, I'm thinking about adding a second one that would be more educational, that could be on a particular topic that we could then follow up with this meeting, where people could then, after having seen the first part, the webinar and the educational information, we then could come here to ask questions about that. They could certainly ask questions with that as well. So I'll let you take over now, Haley, as far as these next two slides, and then we'll give you a little class on lumps and bumps, and then we'll go into the questions. And then I also decided that because people just stay on even after the hour's up, that we're just going to answer every single frickin' question there is. So, and we'll end when that happens. So it could be, 75 minutes, it could be 90 minutes. Can't imagine it would last longer than that. But we're in it to be sure to get your questions answered. So, Haley.
Absolutely. So thank you for that introduction. I appreciate it. So for today, here's some housekeeping information for you guys. So we have questions that have been emailed to me. We will use those ones first. And you can put your questions, if you have any that pop up during the session or that you have had waiting, you could put them just into the chat for right now. We are still figuring out the Q&A Zoom functionality. So for now, if you have a question, you could just throw it into the chat and I'll make sure to get to it. And like Doc had mentioned, we plan on answering all of the questions, no matter how long it takes for you guys. And we'll see if there are common threads to questions, similar questions that we might group together. Those may take priority over the other ones if more people have those questions. And then if you aren't understanding what's going on or you want to ask something, just feel free to raise your hand. We do have the gestures enabled, so you can raise your hand and then it'll make sure that Doc knows that you do have a question there. And then this is our disclaimer. I'll just read it to you guys so you know. So Doc Rob wants to be able to help everyone. He is limited in his ability to give the perfect answer to your question because there is no doctor-patient relationship that is created when he is physically examining your pet. Plus, he doesn't have your pet's complete history nor any copies of diagnostic tests to help him understand your pet's specific issues. So please understand the limitations inherent in this platform. Doc Rob will do his best, but there may be a need to follow up later with an email conversation. Yeah, next one there. Perfect. And then, so a little bit of an overview for anyone who's first time here, or, want to know what's going on here. So we plan on offering these Doc Rob Lives the fourth Thursday of each month at the same time. So that would be 6 p.m. Mountain, 7 p.m. Central. So these sessions will be recorded live, and the recording will be posted on the WellPet website. It's wellpetdispensary.com and then /videos. Also on our YouTube channel. And it might take a day or two just to, make sure I get the recording, all trimmed up and stuff there. And there's a mushroom for that, which will be the text that we will be using throughout, which is Doc Rob's book here. I don't know if my blur is too much. But this will be the reference text for these live events and for his ongoing health mentoring of pet parents. There is a link there to order the book through Amazon. It is available on there. You can get it really quickly. And then if you do order on Amazon, please send us your Amazon receipt to questions@wellpethelp.com. And we will send you a discount coupon for 25% off for 2 times for anything on the website. And, let us know, like he had mentioned before, what you think about, the second live hour monthly that's a little bit more technical, a little bit more educational. That could be an option, in the future here for us. So if you guys, we appreciate all feedback. If you have things you like, things you don't like, we really do appreciate hearing what you guys have to say about, what we're doing here. So thank you again,
Well,
and I guess we can get
I think
started.
that, yeah, I think that pretty much sums it up. Um, yeah, and bear with us as we're exploring this platform and trying to make it a better experience for you. And this month's topic are lumps and bumps, which could translate into cancer, certainly, but is not necessarily cancer. And that's kind of what I want to see if I can give you a fairly large overview of things and then that may help to seed some questions or at least give you information. Then we'll move on to the questions. So, what are lumps and bumps? These are generally visually um, eh, um, little bumps or masses on the skin because you can see them. So that's kind of what we talk about in general. And that's a whole concern for many pet parents because, as pets age, there are some, not cancerous, benign types of lumps that will arise, just as there are some cancerous lumps. And, we don't necessarily want to get too anxious or put an animal under anesthesia to remove lumps and bumps if they're really not a threat to the animal's long-term health and longevity. At the same time, it's good to know what they are. And it's and although there are some lumps and bumps you can look at, and from looking at them, you can kind of get an idea that this may or may not be dangerous or may be something we need to look at further. Um, Oftentimes we have to do a deeper dive into those lumps or bumps to understand them. Now, lumps and bumps are on the surface of the animal, but we also can have lumps and bumps internally that we can't see. We call those tumors or masses, but they're still part of the same conversation. And so, some lumps certainly can be cancerous, but some of them can be cysts. Some of them can be, not a very threatening type of cancer. And we'll talk about what those definitions mean. Um, and so we need to know, are they a problem? And we can't just guess about that. And sometimes it's best to kind of get in there early to find out what it is before, if they are malignant, before they're malignant and spread, or simply because when they're smaller, they're easier to remove. There's less trauma, there's less anesthesia time, less cost, less, morbidity, less problems post-surgically and with everything else, to your pet as well. So, what exactly is cancer? Well, cancer, is really described as the uncontrolled um, um, division and growth of cells. And and it's uncontrolled because generally there is some sort of mutation that kind of short circuits the normal mechanism of division in a cell, and the cells will just keep dividing without any kind of organization. And that's why we see the lumps, the cancerous masses and the lumps, oftentimes growing to very large sizes. Oftentimes we see them being irregular. They're not like nice and smooth and not, and oftentimes not encapsulated by something. Um, and and some types of cancer, the malignant type of cancer, which I'll explain next, are so aggressive that they actually can leak into this. The cells can kind of work their way into our blood system and travel to remote places where they can set up tumors in other locations. And once we call the primary mass that we find, once it travels to another part of the body, it's then much more difficult to remove the cancer. And so over time, these malignant cancers will spread to the first place they go to oftentimes is the closest lymph node to wherever that mass is. The second place they may go to is a major organ in that area. The third place they may go to is they may travel further to the liver or to the lungs, which oftentimes are the final location, although sometimes we'll see these masses also go to the brain, and that's where we get some of these brain tumors. Sometimes we'll see brain tumors as a cause of some of the late onset epilepsy that we might see in some of our, older patients. Cancer that is benign is are cells that are dividing uncontrollably, but in a controlled fashion. So they tend to not spread. They can be very problematic simply because they grow to a very large size. And if they're in a bad location with that large size of growth, they can still cause some serious problems and need to be dealt with. For instance, a tumor that's benign in the closed, environment of the skull, that as it grows, it's going to push out the brain. So that may be a cause for epilepsy. That may be other causes for for neurologic dysfunction. So that's so when we identify that we have this problem in an animal, um, as someone as a doctor, as a veterinarian type who gets to see many of these, holistic vets oftentimes get to be kind of on the job training types of oncologists because so many people will come to us with their pets that have cancer, oftentimes in the 11th hour, because whatever they were trying or whatever was conventionally being used didn't work, and the cancer gets big and the animal's being affected by it. Then they come to us, and it's a challenge, because we don't get the same kind of success we could if that came to us early. And so part of my message with saying this is I urge you, to come in as soon as you can, because the earlier we get to one of these types of problems, the better our chances are of solving it, maybe solving it completely. So, and like I said, even if it's benign, it can be a problem. Certainly, if it's a malignant, it can also be a problem. And how can you tell if the lump is a problem? Well, we really, you can't necessarily tell from the external appearance of the lump, although sometimes it's not that difficult. But ultimately, we have to look at the cells microscopically, which means there has to be some sort of veterinary intervention. There has to be some sort of sampling of that lump. And if your veterinarian is great at cytology, which was something I really loved, I was kind of a nerd that way. Oftentimes we can diagnose it right there in clinic, from a quick little needle aspirate. But sometimes it's confusing, and if the treatment is really dependent upon the diagnosis, then we would want to send that sample out to a pathologist who's trained to really give us the exact answer. And even pathologists sometimes don't get it right, and we have to get second opinions from other pathologists. It's not always a slam dunk when it comes to the diagnosis. If the lump's internal, not on the skin, of course, we need to first know that there is a lump internally, and maybe that would come as your vet, palpates the abdomen, or maybe the lump becomes so big that it's obvious that it's that way. But sometimes we only find out about it because of the symptoms of its growth. For instance, when we have a tumor of the spleen, which we call hemangiosarcoma, which can be a pretty aggressive tumor. Oftentimes it grows so large before we even know it's there that it ruptures. And basically the animal nearly bleeds out into its abdomen, gets very weak, it gets pale and anemic, and those are the first signs that there's something going on. And an X-ray isn't really going to tell us there's something on the spleen perhaps, but won't tell us what it is. So that's where an ultrasound can give us a lot more information. And many clinics will have a radiologist come in with their ultrasound device who can not just identify the lump, but can also use a fine needle to penetrate the abdomen painlessly and go into the lump in a very safe way and draw cells out that then could be sent to the pathologist so we get a more accurate diagnosis. Okay, so next slide. Now we know we've got something that's cancerous. Maybe it's benign, maybe it's malignant, maybe it's on the surface, maybe it's inside. Um, we need to know what to do. So, first of all, one fact is that even though when you see the lumps on your pet's skin, it gets you pretty anxious. We don't know what they are. And the reality is that statistically, most of the lumps and bumps that we find, they're not cancerous or malignant. But, when they are, but we can't necessarily just tell from looking at it. Even multiple lumps in the same area don't necessarily mean malignancy. It can still be benign, or they can just be cysts arriving in the same area. Lipomas, these are these kind of little jellyfish-like fatty tumors that are underneath the skin, and they're very visually annoying to people. They want to remove them, or they want to find methods to eliminate them through supplements. And I've heard, some anecdotal reports of some mushrooms like turkey tail, and some other types of supplements being able to eliminate these lipomas or make them smaller. In my own practice, I've never had that success. So I've always, said, don't worry about the lipomas, because there's really no need to worry about them, just that they don't look great. Except if they're in an area like a lipoma, let's say on a large lipoma on the elbow could interfere with the movement of that joint. That would be a reason to remove it. Some lipomas, are actually malignant. They're called liposarcomas. And they're nasty because they go in and they dissect in through muscle layers, and they're really hard to remove, and they are kind of nasty. So, and that would have to be defined more by a little sampling of the lipoma to see what it is. Usually, we don't sample most lipomas, but a veterinarian can tell oftentimes how that it is malignant. Mast cell tumors. Mast cell tumors are a really big bugaboo, for for a lot of pets and pet parents and for vets as well. But the reality is that most mast cell tumors, are not a problem. That we have different grades of mast cell tumors, and many of them are low enough that they just arise. And there they are. They could stay there forever, or they could be removed. Sometimes we'll see these mast cells become more aggressive, but that's not necessarily always what can happen. We can have higher grades of mast cells, and the highest grade of mast cell can be really aggressive and nasty. So I think the best thing to do with mast cells is to find out what the grade is before you start getting too aggressive about it. Um, but it's a cause for concern, but many of them are really not a problem. And I think that in my experience with the cases that I've seen from the hands of other veterinarians, I think that oftentimes I think we're overly aggressive in removing these. I don't think that they necessarily have to be removed. It depends what grade they are. And if they're just low grade and just sitting there, I think they're just fine staying on the animal. And then we've got other things that aren't cancerous. We've got warts, which is a viral infection, and we've got cysts and pustules, and we've got granulomas, which are basically, very fibrous tissue growths that are that are kind of an immune system reaction to something. So, we need to know what it is before we know how to do something about it. And that's what our plan of action is dependent upon knowing what we've got. Is it non-cancerous? Is it benign? Is it malignant? Where is it? What are the statistics? How hard is it going to be to remove that? We have to figure in the cost as well. I know all of us, love our animals so much that we would bear any cost, but the reality of budget, comes in as well. And we'd like to not, spare any cost, but nonetheless, there's the reality of budget. So the plan of action needs to be, it's kind of multifactorial. You need to discuss it with your vet, maybe bring in a second opinion, maybe talk to a holistic veterinarian, or an oncologist. I personally think that, when we do identify that there's cancer, especially a serious type of cancer, that it's always a good idea to go talk to an oncologist. I think they can give you a lot of perspective on what the statistics are in terms of what the biological behavior is of that mass. Once we have a diagnosis of it, they can tell you what the choices are in terms of the treatment, and what kind of statistics we have in terms of recovery and return. You may not need to actually, and you don't have to necessarily do what they tell you to do. I think they're a good source of information. You may want to go from there, to a more naturopathic veterinarian who maybe specializes in in oncology. And we have finally in our country, I think there's 5 or 6 what we call integrative oncologists. These are veterinarians who are board certified as conventional oncologists, but have taken the step to learn even more. And we've got some, and they're really great. We've got Betsy Hershey in Texas, and we've got Erin Bannock up in Michigan, and we've got Kendra Pope in New Jersey. We've got Luminita Sarbu in Seattle, and we've got Marie Jansen here in Denver. And there may be more, as because I think it's becoming very popular because it does provide, because holistic medicine does provide additional support for the cancer patient, whether the cancer patient is undergoing surgery or undergoing chemotherapy or radiation or not going through any of those and instead getting supplements and diet changes and other things that we use alternatively to treat cancer, which we'll talk about just a little bit in the next one. So yeah, and things to look about with malignant tumors, they oftentimes have irregular borders. They can be firmly attached to the underlying tissue. And we use the word cancer, so it's like a cancer. Oftentimes it has these tendrils and these parts that go out and move into the tissue. They can be reddened. They can be warm to the touch, not warm to the touch, and they can also be uncomfortable to the animal. So those are external characteristics, but we nonetheless need to get a sample of it to know exactly what it is. Oftentimes it may be growing very rapidly as well. So one thing you can do if you're not ready to go see the vet, if you're not really ready to engage, and it looks like it's just a small little lump, and maybe it seems like it's more benign characteristics, because a benign one would have regular borders. It wouldn't be firmly attached to the underlying tissue, and it wouldn't be reddened, and it wouldn't be warm to the touch or uncomfortable in most cases, unless it's in a location that creates discomfort. Um, so if you measured the size with a ruler and then kept a little journal of that week to week to week, you then get a sense, because oftentimes we get confused about whether it was that large a week ago or not. So measure it, that's the best way to do it. And then you have an idea of how rapidly it's growing, which may give you an idea that you need to do something versus just watchful waiting. So veterinarians can, in a very minimally invasive way, can aspirate the lump. And what the aspiration involves, take a tiny little hypodermic needle, really, maybe about an inch to an inch and a half, and depending, of course, on the size of the mass, and we just put it into the mass in a couple of different locations. And what happens is when you put it into the mass, cells from mass get inside the inside of that needle. And then you attach a syringe to it and you spray that out onto a slide, you let it dry and you stain it, and then you can read it in the clinic, or you can send it out to a pathologist. And this does not cause the spread of the cancer. I think that it's much more important to find out what it is than the eensy teensy whittle tiny chance that it might cause a spread. Tumors that are inside the abdomen, there's more of a chance for them to spread. So it depends on what kind of tumor it is. It depends on how it's sampled, but typically we really don't. I get this feedback all the time from pet parents that, oh, I don't want to go biopsy because I don't want it to spread. That's really a very, very uncommon occurrence, only with certain tumors that are super, super aggressively malignant. But I think it's so much more important to know what we're dealing with than to worry about that very small potential for that to happen. All right, getting there. So what to do? What about interventions? Well, first of all, do nothing. Let's do watchful waiting. Let's reassess regularly, whether it means going to your vet or measuring the tumor or keeping a journal in that way. Certainly, surgically, we can remove a superficial lump or a bump. And in some situations with many animals, we can use conscious sedation and local. So it's very short acting. We can get that tumor off. We can get it into the jar and send it off to the pathologist. And, we can stitch it up in a way that the animal's not going to bother that incision. So surgical removal superficially, that's fairly casual as compared to surgical removal, of an internal mass. There also are topicals that could be used. They're not super great. There is one that that was available, and I understand you still can get a hold of it, called neoplazine, and it's an extract of a plant called sanguinaria, and when you apply it to the tumor, it eats away at the tumor. Unfortunately, it also eats away at healthy tissue. So it's really not something that can be done in home, I think, by a pet parent. Needs to be done under veterinary supervision, maybe needs to be bandaged as well. And you can also look at using topical CBD or topical THC, which also have some anti-neoplastic benefits. And there may be some other topicals as well. Of course, we would like topicals because it's very non-invasive that way. There aren't those many topicals that I know of that work that great. With internal masses, it's another story, and best to diagnose it using ultrasound so we know where it is, what its size is, what are potential complications from it, whether we remove it, or what are potential complications from it if we don't remove it. And we then can also, while under ultrasound, I think this is the very best way, we can biopsy or we can aspirate the mass. The biopsy means taking a little piece of it. It's a kind of it's a larger sample. And for some things, it's very important to have that to know what we've got. Other times we can just use a needle aspirate, and that can give us an idea of what we're dealing with. Maybe we're going to remove it. That's a decision needs to be made based on what it is, where it is, age of the animal, budget, all those different considerations. Um, can we address it with supplements? Certainly. Are the supplements going to work? Well, they'll be helpful. I couldn't guarantee they'd be 100% effective in totally, curing it or removing it. But we do hear of anecdotal reports. There are some types of cancers that are very responsive to mushrooms and things like that, CBD. We can address it with pharmaceuticals as well, and there's more and more pharmaceuticals out there. There's some that are local injections. For instance, there's an injection now that we inject into mast cell tumors that can remove them. So there's a lot of things coming down the line. Many oncologists now are doing genetic testing on the tumors to find out what are the best ways to address them. And probably the best is the integrative approach, the combination approach. Get them on supplements. Give them a diet that's not going to feed the cancer. Look at what pharmaceuticals you can use that aren't excessively toxic. You know, and see how you can blend them together to find the best solution for your animal. Each case is very individual, and it's wrong to think that because this helped for this person or this animal, it's going to help for yours. You really need to evaluate each of your animals, each time you have a problem like this in your animal, you need to evaluate it specifically for that animal and those situations. All right, so that's kind of my little teaching session here. I hope that wasn't too much for y'all. And I'm going to open it now to questions. So, what do we have, Haley, as far as some of the questions that were sent in? Let's get started with these.
Sure. So, first question here. When is it appropriate with a firm lump to have a needle aspirate for biopsy? At what stage of growth and realistically are there issues with cancer scatter cells?
Okay. Well, as I had mentioned, and I did anticipate a question like this, although I didn't know we had one because these are the kinds of questions you get all the time, in the exam room. I think it's appropriate when you think that the mass is a potential problem and you want to find out what it is to either eliminate the fact that it is a problem and you don't have to do anything about it, or to be aware that it is a problem and to get more aggressive about doing something with it. As I said, the risk of it spreading is very, very rare, and you might hear stories. And these are stories are, and you always tend to hear, it's like people tend to remember the bad stuff, out of how many thousands of aspirates, do we have one situation, where it can spread? So I think the value of knowing what you've got is more important than the tiny risk of it spreading.
Sure. So next question here. So there's a couple of questions. This is referring to fatty lumps in particular. So
Okay.
are the lumps formed in labs because at adolescence they are overweight can by keeping your lab at a healthy weight resolve the issue?
That's a good question. And, we do see an increased frequency of lipomas in dogs that have hypothyroid. And in hypothyroid, they don't have the energy, they don't have the hormone to metabolize fats as well. And I think that the commercial foods, because of their processing and the lipid peroxidation of the fats, also can be a stimulus to the formation of these lipomas. Um, but I think there also are some dogs who just have that perhaps as a genetic tendency. I find labs in particular seem to have a high risk of that. And so by keeping the animal lean and by keeping, by making sure you're feeding a good food that doesn't have as much heat and pressure processing as we see in kibble, and getting healthy fats like medium chain triglycerides and flaxseed meal for the omega-3s and omega-6s and fish oil, I think you stand a better chance of reducing the incidence of these lipomas. But old Bean, my black lab, I started him out at when I brought him home at 8 weeks of age with homemade food, um, mushrooms, black beans, all that stuff. Um, and he ate really good food his whole life. He still wound up getting some lipomas, and he wound up getting anal gland cancer in spite of everything I did. So, I think we do the best we can, and but then we have to deal with the what we have in terms of our animals' health and health status and everything else. So I think that helps. Next question.
So, on the fatty lumps as well, can rubbing castor oil resolve or dissolve them?
Well, the castor oil is an old-fashioned naturopathic approach to help break down lumps. And so I think it's worth a try. It's used a lot with as a women's remedy for things like endometriosis and stuff, because when it's used topically and you have to get the castor oil and you need flannel, it needs like a cotton flannel pad for applying it, and you need to warm it up and then you need to apply it over that lipoma. And you probably need to do that on a daily basis, a couple of times a day for a number of weeks in order to address it. I think it's worth a try. I really do. It's non-invasive. It's topical. Castor oil is really bitter tasting. If they start licking their hair, they're not going to like it too much. But I think it's a legitimate approach.
All right, next question here. My beloved senior dog, a white poodleish guy of at least 12 years, has always been itchy. His skin has changed in the last 18 plus months or so. Even his coat has developed apricot patches. This may have started 2 to 3 years ago. He had a mast cell tumor on his chest removed several months ago. Pathology stated clear margins were obtained and it was a grade 2 low grade specimen. While under anesthesia, he had about a dozen bumps removed by laser, one a larger cauliflower looking growth. He's on about a dozen different supplements. So he's on the Nettle combo, Dr. Ruth Roberts. I'm so sorry to mispronounce this. Quercetin.
I'm sorry, say that again.
Uh, is it Quercetin?
Of course, quercetin, yes.
Quercetin.
That's
Okay.
it.
And then
Mhm.
I also give him liver tune, which is Dr. Peter Dobius or
Okay.
Dobias. 1 week on
Tobias.
and then a break. He continues to itch. Food is Stella and chewy raw freeze dried rabbit or duck turkey. Um, so Theo was diagnosed with SLO and is on a protocol of omega oil,
What?
vitamin E and biotin. So
I don't abbreviation SLO. I'm sorry.
autoimmune nail disease.
Oh, okay. All righty. Go
It
ahead.
says here. So
It's
for at
not
least 2 years now, he has had around 2 centimeters inflammation at the base of his tail. Again, under anesthesia, needle aspiration was done. Vet wasn't sure what he saw, maybe some mast cells. So she's really looking for, maybe some more ideas on what she maybe should be using or if anything.
yeah, well, Yeah, it's a complicated medical problem that the dog has, and I'm not sure I can weigh in on all the details of it. But I will say that, that we do see a greater incidence of mast cell tumors in dogs who do have allergies. And so it sounds like that's what we're kind of seeing here with the allergies. One supplement that I think is worth looking at is a relative of CBD, and it's called PEA for short, or if you want to get fancy, it's called palmitoyl ethanolamide. We have it um, on our well pet dispensary store as well, and but it is available from other sources. And so the palmitoyl ethanolamide has been shown in studies in dogs and in cats over, if it's used for like a month or two, to really help to downsize and bring atopic animals, that means allergic animals, into a better place of control. So that would be one thing. Also, I don't know if you're on TikTok, but everybody's saying use probiotics, change the microbiome to help improve atopy as well. And that happens to be true. Whether the simple use of a probiotic that you could buy on TikTok would work, I don't know. Um, but I think, we're looking at things like, fecal microbiome transplants, which we now have, that we can now do that with oral capsules. So it might be worthwhile to look at altering your pet's microbiome and maybe get it into a place where the microbiome can create greater health and less allergies. Um, I would also, in addition to giving it the microbiome fecal transfer, I would also put it on a very powerful probiotic with a very high count. I'm very fond of the yeast-based probiotic, Saccharomyces boulardii, but there are a number of good probiotics out there. One of the aspects of a probiotic is you want to have sufficient numbers of bacteria that you're inoculating, and you probably want to have in the billions, maybe 2 to 10 billion as a single dose per day. There's a mushroom formula called um, um, called the Five Defenders, sorry. And Five Defenders contains two mushrooms. One's called chaga and one's called reishi. And they have these types of molecules in them that are called terpenes, which are known to stabilize mast cell membranes. So, and we know that that's also what the PEA does as well. So the combination of the PEA and the mushrooms, and the microbiome alterations could be very helpful. I'd also recommend, I didn't quite get all the details, but fish oil itself is extremely valuable to help as an anti-inflammatory agent, to help improve the health of the skin, and to kind of reduce those symptoms of inflammation from allergy. And we want to give a fairly high dosage, and the studies show it takes about 3 months for fish oil to really kick in and have a totally good benefit. So be patient with those kinds of things. So those are a few things, trying to look at what you're feeding and can we find out if maybe there's some allergies to what you're feeding. I personally like the NutriScan saliva test for that, so that you can make sure you're feeding a food that's not allergic, not allergenic either. So those are a few things that are almost like lifestyle changes versus something that would be specifically interventional. And without really knowing the details of a complicated problem, that's the best I can do. I hope it's good enough.
So this is another question that has a little bit to do with allergies as well. Uh, are
Okay.
there any natural treatments for allergies in cats other than steroid medications? My cats have either fleas or mites, and it's causing bumps around the neck. My one cat ended up with a bald spot on his head after scratching so much. I've used Manuka honey, which has helped heal the spot, used flea tick shampoo, hot spot treatments, flea comb through, natural flea treatments, etc., but they are still scratching and licking.
Well, it does sound like the external parasites, are stimulating a lot of this itchiness. And you've taken some measures to try to eliminate them. Maybe there's some other ways to do that. You know that fleas spend most of their time off the animal, and so it's very important to treat the environment. And one way to treat the environment is with diatomaceous earth, which helps to dry out the flea, and you can dust it. You dust your animal with it as well, but they do spend 90% of their time off of the animal in the bushes around your house, around the baseboards inside your house, kind of outside, and they're just waiting for, an animal to walk by that they can jump on it to feed. They then feed on the animal, then they jump off and lay their eggs in the environment. More fleas hatch, and then they jump back on the animal, and bingo. So there's also things called insect growth retardants, which aren't toxic to mammals, that could be also used in the environment to help reduce the fleas. And if there are mites take a more specialized approach, so you may need to see your veterinarian to help you with that. And I would say it's really important to eliminate those ectoparasites, in terms of addressing it. There's no magic pill I can give that's going to make that skin better until we can stop them biting your animal. So I think that's really the major focus needs to be on, in order to get to the next place where we're going to be doing a little better and being more comfortable.
All right. So, what is your opinion on using red light therapy for mast cell tumor lumps?
Well, maybe the red light would help to reduce some of the inflammation in the mast cell. Red light therapy is effective, but it's not very strong and it doesn't last very long. It has to be reapplied daily or a couple of times a day, to have the most amount of effectiveness. I don't see a problem with that, um, because it has an anti-inflammatory activity to it. I'm not quite sure, you know, you know, why you would do that though. I don't think it's going to resolve it, but I haven't really tried it, so I'm speaking just, off the top of my head, and I'm open to anything working, and let us know. Try it. Let us know. If it works, we'll try it ourselves.
All right, next question here. What is your opinion on the use of topicals, like essential oils for lumps? I know, we had discussed castor oil before, but what about anything else?
Well, I think that topicals can be useful and can be helpful. And I've heard anecdotal reports of tumors going away with the use of copaiba or frankincense, or some other more tumor specific essential oils. I think essential oils are great. I'm an herbalist, and and essential oils are basically the most potent part of the herb. So I think it's a great way to apply them. You can apply them topically to the mass. It depends on where you're applying it, and if the animal can get to lick at it, which maybe is not a good thing. um, but you can also apply these essential oils to the animal as a whole. If you put some drops in your palm, rub it in, you can really just rub the hair coat like that. And the essential oil goes down to the hair follicle, and that's how it gets into the systemic circulation to do its thing. You can also, like I used to use in the exam room, I used to use peppermint oil quite a bit to calm dogs down. And what I would do with the peppermint oil is I would just put the essential oil of peppermint in my palm, and I would rub the front pads of the dog into that. It wasn't caustic, it didn't irritate them. I didn't have to dilute it out in an oil, and the warmth of the pads caused that essential oil to vaporize. Of course, their nose is right there. And peppermint oil, like lavender, but for some reason in dogs is even more calming than lavender, is a very calming essential oil. So I think it's a good idea. But yeah, and I appreciate everyone trying to find less invasive ways to address the lumps and bumps, because for goodness, we don't really want to be subjecting our animals to harsh treatments if they're not necessary. But there's also, with many of these approaches, they're not as reliably successful, as some of the conventional approaches. So we have to weigh, the pros and the cons, the risks and the benefits to each, and also knowing what the severity is of what we're trying to deal with, which should also, help us to order our priorities. So if it's something that's really fairly benign and not a problem, then certainly using less invasive approaches is a great idea. If it's something that's aggressive, and if we don't do something effective in a short period of time that's going to spread and kill your animal, I'm not for that, and so I'm a integrative veterinarian. I'm not, I'm holistically minded, but I really do believe that there is an appropriate time and a place for drugs, for surgery, for medicines, for all of those things. But you just, and they've gotten a bad rap because I think they're overused and I think they're used poorly. I think they're overused and not used appropriately. But I think pharmaceuticals are great. You just need to know how to use them right and when's the appropriate time.
All right, next question here. I found a mass in my 6-year-old's mouth. It is large enough that I cannot see the tooth behind it. My vet recommends removing it and sending it in to be tested. Should I request aspiration first?
Well, most of the lumps that we find, in the mouth, are these types of gum masses, gingival masses, epulus, things, odontoma, things like that. Um, and they're pretty hard, quite frankly. But there could be other masses in the mouth as well. We can get oral melanomas, for instance, which can be very aggressive. So I do think figuring out what it is before putting the animal under anesthesia is a good idea. Especially if the animal's older and maybe it's a bit of anesthesia may be a bit of a risk, although we've got some really great anesthetics these days as compared to what we used to have that gave anesthesia a bad name. Um, so if it's a really hard lump, like an epulus can be or an odontoma, we might not even be able to get any cells from that aspirate, um, but it's worth a try. And the aspirate itself, because these tumors oftentimes are invested with a very high level blood supply, even just aspirating it could cause, some excessive bleeding, not nasty bleeding, but would need to be taken care of. If you can't get a good aspirate, then it sounds to me like the size of the lump is really interfering with this dog's ability to chew. And we know that being able to eat food is a really important thing. And when you have dental problems, whether it's a mass in there or severe dental disease or loss of teeth, where they can't chew and they can't, you know, really get the food in them properly, that these are gateways to a lot of different types of problems that they can have, a lot of different diseases. So I think, it's I don't think it's etched in stone. Don't aspirate, do aspirate. I think it depends on the quality of the lump and how well they can actually get any cells out of it to see what it is.
All right, next question. I have a 12-year-old cattle dog mix who started growing lipomas in the past year, and now I find out she is hypothyroid. Will addressing the
Yeah,
thyroid reduce the lipo? Am I saying, I'm so sorry, am I saying that right? Lipomas?
yeah.
Reduce
I pronounce it lipomas, but I'm
lipomas. Okay. Sorry about that. Will addressing the thyroid reduce the lipomas, or do they remain after the thyroid is addressed?
Well, I think that the addressing the thyroid is really important because there's so many problems that can arise from from being hypothyroid, these skin problems and whatnot, and some of them could, as I'd mentioned, could be these lipomas, as I mentioned early on when I was talking about lipomas with the slides. So yeah, I would get that thyroid regulated first and see what that does. Also, hopefully getting some healthy oils, getting off of the processed oils, will also be a good thing to do as well. But I think definitely thyroid is a big problem and it needs to be regulated and it needs to be regulated with hormone replacement therapy. Herbs aren't going to work. Whole thyroid, desiccated thyroid can help, it depends on how severe it is. But that's actually a good thing to have that be a thyroid problem because maybe it will make the lumps go away, and just to find it is a good idea because it will make your dog a lot happier and a lot healthier. Oftentimes we see dogs who have thyroid disease actually being pretty depressed. It really affects their mentation and their emotions as well as their skin, digestion, makes them more susceptible to cancer. So got to get that thyroid, regulated.
All right, next question. My 10-year-old lab has several lipomas. She is 76 pounds. I have had her on turkey tail and lion's mane for about 3 months. I have not noticed any difference in the lipoma. I am giving her a half a teaspoon twice a day. Is this dosage okay, or should I increase the dosage?
Well, as I mentioned from my own experience, I'm not surprised you're not seeing anything. it certainly won't hurt to increase the dosage if your lab will accept them. You know, most labs are pretty foodie, and we can usually sneak stuff into them. Ollie, he's too suspicious of me. I can't really sneak large amounts of mushrooms in him. But I would go ahead and I would double that. You know, you said it was like a 75 pound lab,
Mhm.
teaspoon of each. You know, if you can afford it, and your lab will take it. I think you should use a much, I mean, you've given a good chance at a reasonable dosage. Let's try a higher dosage, you know, a larger amount. Try a full teaspoon of each twice daily if it'll accept it. And if that's enough that if it's going to work, it will. But I would, you know, it may take a couple months, you know, keep at it.
All right. So, can large tumors be healed, and what causes the back leg muscles to weaken? I would like to know what to order to help shrink slash heal my 11-year-old golden retriever Bella's large baseball-sized tumor located on her lower abdomen. She delivered 8 puppies when she was 4 years old. One passed at birth. The tumor has different pink, white, and reddish colors. It has been bleeding the past 7 days and was bleeding some 2 weeks ago. Her muscle in her back legs is very thin and she struggles to stand, so we help lift her most of the time now. I looked up homeopathic remedies in my book, The Encyclopedia of Natural Pet Care, and I have been giving her, it's a THUJA, Thuja,
Sorry.
THU
Oh, yeah, Thuja.
Thuja
Thuja.
and silica once a day, sometimes twice. I put her on raw liver, cooked organic chicken, and broth and sardines. I was giving her Parasite A powder on her food, collagen, cholera, and ASEA, but she stopped eating the food with all the added ingredients. Also, I've been giving her standard process canine immune for many years. And then she also mentions that her son started working for an organic CBD company. So we've been giving her 3 drops a day of pet CBD. Have also been doing emotional work with her. So definitely, trying everything. But definitely wondering if these larger tumors can be helped and what causes those back leg muscles to weaken.
So you're certainly using a lot of resources there for your golden, and as many things as you're giving, I'm not surprised that maybe she's a little unwilling to accept them all in the food. You might want to try to trim down some of the things. I'm not sure they all, you know, are effective. Certainly not effective for that mass. And it sounds like it's a superficial mass, because you can describe the color of it and that you say it's bleeding versus something that's in the abdomen. So, you know, it's obviously not working what you're doing because the mass is continuing to grow and kind of outgrowing its blood supply, which causes it to ulcerate and then to have some bleeding. So that's the one problem. The other problem is the hind end weakness. And you know, in older dogs, we oftentimes can see problems with discs in their spinal column, where the disc could be just like with humans, get a little slip disc, which can affect their ability. We can also see problems with the knees or the hips, you know, in terms of arthritis or types of injuries to the ligaments. So I mean, you know, it's a whole can of worms that you're asking me about that is really difficult for me to answer because I don't have the information. But and I don't know details about the health of your animal other than those two problems in terms of how well it would withstand the rigors of anesthesia. But boy, it sounds to me like that mass needs to be removed, you know? It's bleeding, it's you know, it's ulcerating, you know, it's just not doing any good, you know. And so if she's still healthy enough that you're in the place that you're gonna that she's going to stick around for a while, then and there's no impediments to the use of anesthesia, I think she'll be happier to remove that lump. Now, I've seen some dogs with lumps so big that it made them weak in the hind end just to carry that extra weight. I'm not sure that's the situation here, but you know, I think that in this case, you know, it really at this point, I think you're ready for a conventional approach, ready to get some diagnostics to find out why they're weak in the hind end, either through X-rays or, um, a, you know, an orthopedic exam, that sort of a thing, neurologic exam, because it could be orthopedic in terms of arthritis, or it could be neurologic as well. So, I wish you the best.
All right,
Next.
next question here. Our 8-year-old boy bear has a lump about an inch from the end of her tail. My vet called it happy tail. He aspirated it, but only got blood from it. We were to watch it and see if the bruise would be reabsorbed, but it was not. It has now gotten larger. We are planning to re-aspirate the lump to see if there is any other fluid besides blood in it at this point. Should that be sent in for pathology? Does a blood-filled lump indicate a more serious issue?
Generally, it does. I mentioned hemangiosarcoma as a disease of the spleen, but we can also see it in the skin. Uh, Unusual to have it on the tail. Did they say it was the tip of the tail?
Yes.
Yeah. So, I mean,
Yeah, about an inch from the end of her tail. Sorry.
so I hate to sound like the vet who's always up for something aggressive, but it's relatively easy to remove a lump from the tip of the tail, and they don't come back, and just makes the tail a little shorter. So, but I think the fact that it's blood filled certainly is an additional risk factor, and it'd be nice to know what it is. And it may be, especially if it's a dog that likes to wag its tail a lot and whack that lump. I mean, the lump may be a hematoma just from whacking the tail against the wall or something. I don't know, but I would say definitely try to get an aspirate or try to get some feeling for what it is, or maybe it's easiest just to take the thing off and send it in. You're muted for some reason, Haley.
Sorry about that. My printer was making strange noises. So if an cancer
Yeah.
screening, IDEX cancer screening comes back elevated, and after I gave him a bunch of medicinal mushrooms, and in 2 months his results are normal, do I still need to worry about cancer?
So I'm not familiar with the IDEX cancer test. We do have another vet on here tonight, Dr. Todd. Jill, are you familiar with that test at all? What they're testing
I've
for?
had very little experience with it. I'm not a fan of what I've seen so far, but other than that, I can't really say much.
Is it a blood test?
Yeah,
Yeah. So it's one of these cancer marker tests then. Yeah.
that's the one I'm thinking of. Yeah.
I think that there's a couple of tests out there which maybe you guys should know about, since we're talking about that topic. The through the veterinary labs we can draw blood, and there's a number of different blood tests we can do. Some are more expensive than others, some have better rated than others. I've been using a urine test, and I actually have some for sale on my website. It's called Oncotech, and you collect urine from your pet, which isn't always easy. It's a really hard for me to get urine from Ollie, because when he goes to lift his leg and I go to put a pan underneath him, he freaks out and stops urinating. So, what it does is, when you have cancer, there's things called volatile organic compounds that are produced by the cancer. And this is where you've probably heard about dogs that can smell cancer on people or maybe on other dogs. They're smelling these volatile organic compounds, these VOCs. Well, and we know the dog nose is, uber strong, uber sensitive. Well, this test takes the urine and does a little process to it and then puts it in a petri plate with these nematodes that are called C. elegans, and they're being used in a lot of different research studies for a lot of different things, including longevity studies and things like that. And the C. elegans has an olfactory apparatus. It can smell about 200 times better than a dog can. And so if these worms respond to these volatile organic compounds from the urine, then they have validated the test with 5 different types of cancers, although I'm sure there's other cancers that it also would detect, to have about an 85 to 95% positive results. In other words, if you get a positive result, they're pretty certain that there is some underlying cancer. Now, Ollie, I ran the test in Ollie, and they told me he was moderate and that I should retest in a few months. So I just got another test in, and I can't get the urine. I'm going to take it to a vet and have them do that and send the test in and see what we get. See if it went back to normal or if it's getting worse. Because he has a bunch of these little old lumps all over his sternum and his body, and they all feel like lipomas and don't feel malignant to me. and he's got other problems, so I'm not addressing those aggressively right now. So yeah, so I think that's a good thing. If the cancer markers are down after giving the mushrooms, it is a good thing. That may not mean you've cured the cancer. And I wouldn't say get lulled into a sense of security around it. I would keep giving, I would keep being vigilant, and I would keep giving the mushrooms, and possibly even add things to that, just to ensure that whatever it was doesn't come back. There you go.
All right, next question. Sorry. Can you recommend an omega oil for a highly GI sensitive teeny tiny dog? No matter the high quality sourcing, fish-based or algae-based oil, my less than 6 pound dog belches and gets GI distress. I know she needs omegas, but haven't had any success finding one that doesn't make her ill, no matter how small or gradually introduced.
Well, here's some suggestions. One, look at flaxseed meal, which is usually very well tolerated. It has some nice soluble and insoluble fiber in it, which is good for the digestion and good for the microbiome. It has these plant lignans in them, which help to detoxify toxic estrogens and other kinds of toxins. But it also has a very gentle amount of omega-3 in it and a very gentle amount of omega-6. And I would just start with maybe an eighth to a quarter of a teaspoon in each meal, and gradually increase that, as your animal accepts it and doesn't have GI issues. And they're really not known for creating GI issues. And then as far as the fish oil, it might be better to feed something like sardines, which are known to be rich in EPA and DHA, but also have that whole fish around them as well. And it may be that would also help to reduce those GI side effects that you're getting when you're giving a purified oil.
All right, next question here. One of my dogs has a new lump on the tip of his ear. He always had what felt like a grain of rice in it, which we suspected one of the other dogs nipped his ear over 10 years ago. It is now the size of a small pea and hard as a rock. I cannot get a good look at it because he is fussy when touching his ears. Any guidance? We will see our vet in a few weeks.
Well, chart the size of it, and I think when you see your vet, they may have better, they may be better able to touch it, they may be better able to aspirate it to see what's in it. But my guess is it's some sort of a granuloma that maybe have been a reaction from that original injury, and which for some reason has flared up. That would be my guess, but we don't treat based on guesses. So I think it doesn't sound urgent. I think if you're going to see your vet in a few weeks, wait till then and find out what it is, if you can.
All right, so I think we have one more
And
here, it looks like.
we've
Um,
got a lot of questions.
yeah, so let's see
Then we
here.
go to chat. Right?
Yep. So my cat, 8 years old, was diagnosed with cutaneous malignant melanoma back in December 2022 after mass removal and biopsy. In September 2023, reoccurrence was noted and surgery was recommended. It says TECABO. I was told that the tumor was completely excised and my cat recovered without complications. However, 9 months later, I noticed my cat scratching and shaking his head on the side where his ear was removed. Aspiration of lymph tissue revealed metastatic.
Okay, that's a shame. And these malignant melanomas can be very, very aggressive, and oftentimes the location that they're in can lead to them being more aggressive or not. Oral melanomas, for instance, are very aggressive. Well, I'm sorry to hear that. And maybe, there is a vaccine they have for melanoma that can be used, after the fact. That might be worth talking to your vet or to an oncologist about. But I would see, and it's a cat, which of course means that it's going to be more challenging to be able to get any kind of a anti-cancer type of supplements into the kitty cat. Hopefully you're okay with that. Hopefully he has a little bit of flexibility in terms of the foods that he eats. But I would look to increasing immune system vigilance, because it's metastatic at this point in time and because it's recurred. This is like the third time it's recurred. Is that what I think you said in the question? I would try to get as much into that cat as you can. As I mentioned earlier, there are integrative oncologists around, holistic vets. There are some treatments that can be given, at home. There's mistletoe, which can be given by injection, but you need a vet to help guide you with that. And there are some other alternative treatments that can be used, including ozone, and um, including ozone and intravenous high dose vitamin C therapy. Cats are not always that, are commonly very reluctant participants in these types of treatments. But I think starting with a mushroom powder that you can mix in with the food, hopefully appetite is still good. Um, I would suggest starting with something like cordyceps, which is generally very tasty to cats, and or lion's mane or both. And I would start just with a little pinch, and then I would gradually increase it to to get as much of it as you can into the cat, because higher dosages of mushrooms do have a better effectiveness. I'm sorry about the situation. You tried, you really did. But sometimes these cancers are bigger than we are, in terms of our ability to do something about them. So sorry.
And I don't have any more
Okay. But aren't
questions
there
currently, but if somebody, does have them, feel free to put them in the
so
chat or raise your
were
hand.
those the emailed questions, but those were also the chat questions too?
Yep,
Oh, so does that mean we're basically done with the questions?
yep.
What are these 7 things in chat? Are those questions you've asked me already?
Yeah,
Um,
if I happen to miss any, um, feel free, if I happen to miss your question, you could
yeah,
raise your hand or you could put it, again in the chat. Um,
yeah.
okay, here. Oh, yes, 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 yes. Lauren, I apologize. I did see you here. Let me find that question. Um, I did just see that. It kind of jumped a little bit on me. So what are your thoughts on a marble-sized cyst which contains clear fluid that will refill within a few weeks after being drained?
I'm sorry, could you repeat that? I was
Yeah.
looking at questions.
Yes, 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 absolutely. So what are your thoughts on a marble-sized cyst which contains clear fluid that will refill within a few weeks after being drained?
Um, okay, I don't know what the location is. If it's in a location that is not affecting anything, I wouldn't worry about it. You know, it's unless, if you have the animal,
So she mentioned it's a shoulder.
but okay, it's on the shoulder and it's not affecting anything. I would just, hang with it, because it doesn't sound like it's worthwhile to even do conscious sedation in a local. But if it really bothers you, I think, using some sort of topical and you know, um, uh, some lidocaine and some conscious sedation, or just holding the animal firmly with the lidocaine is a way to do it. And the yeah. So Diva asks, what is the name of the urine test that detects VOCs? Oncotect. It sounds a lot like the Oncocept, which is the melanoma vaccine that Pam mentioned up here at 707. Um, and okay. And Diva, you asked about a friend who'd like to participate in these sessions, and typically we have the sign up on the landing page of our website. And once you are, and we encourage you to sign up for our newsletter, which we send out weekly. We try not to be annoying with it, but it has good information, and we always have, weekly discounts, and we'll also have, announcements regarding these live sessions. And if we do, and I'm just getting started, and I'm really kind of testing the waters. I wanted to see, first of all, what I have to offer is something people are interested in. And then just trying to figure out how to expand that. So I can still share, I'm 76. I've been in practice since 1982. I'm not really in practice anymore, although I'm still licensed. And once a vet, always a vet. I can't really retire. I mean, I'd like to, but I'm at my age, I'm better off giving advice and actually being there in the trenches. So I'm just trying to take advantage of that. I hope this is beneficial to everyone. Um, and let's see. Let's see what else. Is there anything else there here?
Yeah, and I did put the link for that test is in the chat there, as well as the wellpetdispensary.com/docroblive.
Mhm.
That's we'll give everyone, the capability to sign up for this here for the next one. So once this one's done, the new one will be able to be
Okay.
signed up for.
Okay. Tina asks, my dog has numerous little lumps in protein in the urine, UPC 2.54, which is high, but the SDMA and FOS are good. Wondering what to give him regarding the little lumps. Wondering what can give him regarding the protein in the urine, I guess is your question. So my suggestion for anything kidney is to go with cordyceps. And cordyceps is very good for the kidneys. And when you're leaking the protein, from the kidneys, then there are some modifications we make with diet, those sorts of things. And but it depends on how badly they're leaking and what the serum protein is, whether we want to bump the protein up a little bit to restore the protein we're losing, or if we want to maybe go with a slightly lower protein diet, which has been shown to be helpful for these guys, if they're um not in a bad way in terms of their loss of protein. Um so yeah, Jenny says it's sometimes hard to hear me. Yes, I am soft-spoken. Um, but I just today I ordered some microphones. I mean, I have a microphone and but I thought I had it on a high volume. Um, but I'll make sure that my microphone volume is up. But I'm also going to get these little microphones that I can just put here that I think will be doing an even better job. I'm getting them to do more kind of like online stuff and social media stuff, but I think it might be good for this as well. Um, and Mary, thank you for your comment, because we are forming a community here, and I think it's great. And Odie's mom from Boulder thanks me. So Cheryl, I'm doing a book reading here at the Boulder Bookstore on July 30th. And come attend, come listen. It'd be great to have you there. And we'll do some more advertising for that. I think that's almost everything, isn't it? Maybe I'm missing my dinner. Let's see. Okay, so I suggest Dr. Judy's PEA. I did my search and hers sounds to be clean bioavailable. I checked out and I love Dr. Judy, and I'm not trying to put her down or anything at all, but I am an expert on PEA. I've been looking at it for years, from my expertise in CBD. And the ultra micronized PEA has the best absorption profile. And when I looked at the source from Dr. Judy's PEA, and I actually spoke to their sales rep because I was looking to create a product like that for my own website. It wasn't micronized. So again, I'm not. I think Dr. Judy's great. What she has done for pet parents in our community is incredible. I love her. I was just with her a couple weeks ago at her international experience. Um, but I think, when you're looking at PEA, you need to look at some of those characteristics. There's an Australian source called Levagen, which isn't micronized, but it has another agent in it that helps to increase its dispersion. And I like the Levagen. The taste is not quite as bland as the ultra micronized PEA, though. Um, let's see. So yeah. What is this? Let me know if I could help. Maybe enough time to have my daughter bring it to you. I'm not quite sure what you're being there, Carolyn. But let's see. Um, what is the urine test? I'm in Grenoble. Oh, nice. Can I contact you privately? Yes, you can reach out to me by email, Merlin. Um, and it's the same email that we were suggesting for your receipt for my book, the questions at was it wellpethelp.com? I think
Mhm.
that's it. Yeah. Do you want to put that in the text there?
Absolutely.
Well, this keeps going and going. It's great. This is what I asked for. This is what I'm getting. It's terrific. So I have the micronized product available on my own website in capsule form. It's a human product until I can formulate my own. And probably what I'm going to do is blend PEA with quercetin and have it focused primarily on allergies. So, but that's a little bit of a ways off. Um, let's see. Oh, you're in the Bahamas. Well, it's at the end of July, Cheryl. So maybe you're not. Um, listening to it. So okay, I guess that's it. I guess. Is there anything else? Anybody? Two new messages. Thank you both. What would those? What the? Oh, in terms and Felicity, you're asking about the dosage for PEA. Um, Basically, we do the dosage for dogs as 10 mgs per kg twice daily. If you can figure that out from your dog's weight, a kilogram is 2.2 pounds. And there's 400 milligrams per capsule. You can't overdose with it, probably better to even do a higher dose. But the studies in the dogs for allergies was 10 mgs per kg twice daily. The dosage in cats for allergies was 15 mgs per kg twice daily. So, and so there you go. That would be what I would suggest. And our next line is going to be on behavior and cognition. Okay. Did we already decided that? Oh,
Yeah,
okay.
yeah, if that's okay with you.
Yeah, no, it's all okay. I hope that's okay with everybody else. That question was asked, right? Yeah. Um, what do you, what if you do Dr. Judy's PEA with healthy fat like MCT oil? Well, I think healthy fats are good. The PEA is an unusual compound. I've tried to make it into a liquid, and it's not really a fatty compound, not really fat soluble, it's not really water soluble. It's kind of weird. I've actually been talking to one company that makes it into a liquid and bottles it, flavors it, so I might be able to make something like that for small dogs and cats. Just so much to do and so little time. Um, but I would combine the PEA with EPA and DHA because of their um, studied benefit, for allergies and for inflammation and for the immune system. Um, and yeah, so I guess we're getting there. Um, and looking forward to having a little dinner here. It's 7 going on 7:30 here. So if we're done and we still have 43 people here, um, I say we call it, unless you want me to, I could read a chapter from my book. Now my book does have, I mean, and I don't know if you guys have, have looked at it or not, but my book does have a lot of information and a lot of the practical stuff that I talk about today. I think as a veterinarian, I'm probably not smart, like really like intellectually smart as a vet, but I think I'm very practically knowledgeable. And I've over, my 35 40 years of practice, I've developed all these little tricks and all these ways of kind of understanding things and also ways of explaining them to my clients when I was in the exam room. So I'm glad to have you all here. And let's see what more we can do with this community. I think this is a really good start. So,
Grabbing the link to the book real quick for you guys.
mhm,
Let's
yeah. So I hope you all have a good night. Have a good month. Hope we all survive this crazy world we're in. And see you next month, God willing.
That was a very large link there. Sorry about that.
It's funny, it sometimes does that.
I know. Sometimes.
Mm. Well, it's been good. I'm enjoying these. I'm encouraged. So keep going. You're welcome, Jen. Thank you. Thanks to everyone. Bon nuit.
I don't know if you've checked out on some of.
Oh, but we forgot the coupon code.
Oh no, I did put it in there.
Oh,
Yep, I put it in there.
where'd you put it in?
Put it in the chat.
Oh, why don't you put it in again?
I will put it in there again though. And then in the follow-up
Uh-huh.
email, I'm gonna throw it in there too,
Hey, yeah, do that.
just in case, someone.
Yeah, because it is limited. So even though we're going to have it on the recording, it will expire. It might expire by the time you get to see the recording. But and how long will it last? How long is it good for?
So that one will be good. Let's see, for 3 weeks.
Okay, and it's 254.
Yes,
The
Doc Rob Live 254.
25%, but the fourth live. Gotcha. Okay.
Yep. And then so the recording will be available on YouTube. Be available on YouTube within 48 hours here, but I will send a follow-up email with the discount code with the recording. I know that there was somebody that had mentioned that they would like to see maybe some of the integrative oncologists, veterinarians that you had recommended. So I'll get those from you. We could put those in the email too for
Okay. Yeah.
follow-up.
Good. Yeah. There's I'll have to get all their contact numbers together into a document, but I was
Yeah. And
today
if
with
you, yeah.
that oncologist.
Yeah, if you want to give me, yeah, that's perfect. That's perfect.
We'll do that.
I could link all of that.
Great. Well, it's great to. And Jamela from Colorado, I will be doing a book reading in Boulder if you're anywhere near on the 30th of July. I'm hopeful to get somebody in the audience.
Thank you.
Hi, Jamela. Hi, Jamela. Where in Colorado are you?
Right by the amphitheater, Red Rocks.
Oh, okay. Nice.
We got 3 acres here.
Nice. Little west of Golden.
Yes.
Yeah. I am coming to Oregon, actually, Lynn. I'm doing a book reading in Eugene and I'm doing a book reading in Portland. Um, on Friday the 18th.
Friday the 27th and then
Oh,
the 28th. Or
yeah,
Friday the 27th is
I'll be in
Eugene.
Eugene on the 27th and I'll be in Portland on the 28th. So do come up and I'll
And
be
and when is the book reading on in Boulder?
July 30th at the Boulder
July.
Bookstore.
Okay, thank you.
You're welcome. Yeah, be nice to see you there. And Canada, yeah, Canada does need a book reading. And I'm trying to figure that one out. I work for a Canadian company, so should be able to figure that one out. And no, the special, you mean the code, Jan? The code is with my website. But iHerb Australia does carry the mushroom products and does carry the pet mushroom, is now carrying the pet mushroom products as well. But we can't give you a discount on iHerb Australia. That's something that's up to Real Mushrooms, not me. Mhm. Nice. It's 6:30 on that Friday. It'd be great to see you there.